Mr. Seaheap?
It is, yes.
Right, so you called the practice earlier with some problems.
That's right. I was getting some flashing lights. I woke in the night, had a coughing fit. Then all of a sudden, lights seemed to be flashing all the time.
Okay, so approximately what time did it happen?
It was about 2 o'clock.
At 2 a.m?
Yeah.
Okay. Are you still seeing the flashing at the moment?
I am, yes.
Okay. Which part of the vision are you seeing it in?
When I shut my left eye, the right eye is getting all flashing lights. When I shut my right eye, everything is normal.
You're not seeing any flashing through your
No.
left eye whatsoever?
No.
Okay, so it's through the right eye and it seems to be on your right hand side.
It seems to be all over, to be fair.
Does it?
Yeah.
Okay, but just through the right eye.
Yeah.
Now, you didn't fall out of bed and bump your head, did you?
No.
No, it was a coughing fit.
Yeah.
You woke up with a coughing fit and then it seemed to happen.
Yeah.
Okay. In your vision, either eye, are you seeing any floaters, little moving opacities?
In my right eye again, it's almost like a spider's gone into my eye, and it's like a spider's web.
Okay, does that appear to move as you move your eye?
Wherever I turn my eyes, it looks to be following.
The spider's web's following, okay.
Yeah.
What's the vision like in the right eye?
It's very blurry.
So there's been a loss of vision as well?
Yeah.
With the flashing lights, okay. There's no pain in the eyes?
No, it's not painful at all.
Okay, so it's painless. Has there been any redness to your eyes at all?
Not unless there is now.
Okay.
Does it look red to you now?
Just look up for me. Okay. Right. I'll come to that shortly, because we might have to get you into the clinic. So we've got the floaters, loss of vision. And the left eye, there's no loss of vision, no floaters?
No,
flashing?
nothing at all.
Completely asymptomatic in the left?
That's correct.
Right, okay. Has anything like this ever happened before?
No.
Okay. Have you ever been to the eye hospital in your lifetime for anything?
Well, not as a patient, no.
No, okay. Do you suffer with migraines?
No.
No. How's your health at the moment?
Well, I'm a diabetic, type 2, but apart from that, not really anything else wrong with me.
How long have you been diabetic for?
Oh, many years.
Over 10 years?
Yeah, I would say so.
Okay. About 15, 20, something like that?
I'll be honest with you, I don't keep track.
Okay.
I know it's over 10 years, that's all I can tell you.
Do you keep track of your blood sugars?
Yeah, and they're fine.
They're under control?
Yeah.
Okay. You take medication, you say, for your diabetes?
Yes, I take metformin. I take 6 300mg tablets. 4 300mg tablets a day.
You don't take insulin at all?
No.
Okay, type 2, that's fine. Any hypertension?
No.
Okay. Any other medication or just the metformin?
Well, because I suffer with a bad back, I'm taking gabapentin.
Okay.
I've been taking that for about 15 to 20 years.
Okay. Is there any family history, do you know, of retinal detachments or tears?
None at all.
No, no tears or detachments in the
No.
Okay, so just listening to your symptoms there, worst case scenario, it could be something like a retinal detachment or a retinal tear, which comes with the risk of permanent loss of vision.
Right.
So it sounds quite serious what you're telling me. Not to worry, I'm going to get you to come into the practice as of now. So,
Well, you want me to come in today?
yeah.
So
yeah.
you don't want... I can't leave it till tomorrow.
No, I want you to come in now.
Okay.
Okay, what I'm going to do is I'm going to look at your eyes, just do a few tests, and I'm going to dilate your pupils, which will make you a little bit blurry afterwards.
Okay.
So ideally you need someone to bring you.
All right. It looks like I'm going to make a phone call then.
Yeah, okay. Hello, Mr. Heap.
Hello.
Are you okay?
I'm all right.
Right. Are you still experiencing the symptoms of flashing lights?
I am,
Yeah,
yes.
it's still there. All right, okay.
Yeah.
We'll do a thorough investigation.
Okay.
And then if needed we'll make a referral. So let's get to the bottom of things. Right, so as you're looking straight ahead, do you see that there's a letter chart with both eyes open?
Yeah.
Okay. Right. Do you see any letters on the chart there?
No, I can't see any.
Not even the top row?
No.
Okay. So just facing me now. Okay. Over this side. Do you see how many fingers I'm holding up there?
It's difficult. It's either 3 or 4.
Okay. Do you see movement of the hand?
I do, yeah.
Okay, that's fine. Keep looking towards me. Just going to introduce a little light source. Okay. Do you see the light there?
I can. It's very glary.
Right, okay, thank you. Just looking straight ahead again towards the chart.
Yeah.
Okay, let's cover the right eye. Okay, which row can you read down to?
I can read there's the red line. I can read the second one below that.
Can you? Just read that for me.
CTD, TE, OP.
Okay. I just want you to look at the E on the row just above the red line at the beginning.
Yeah.
Okay, keep staring at that. I need to just try this light source.
It hurts when you shine that light in
Okay,
there.
I'll be very quick. Okay, there may potentially be a pupil defect in the right eye. Okay, let's dim the lights. Just take your spectacles off for me. Okay, I know it might be blurry, but I just want you to keep looking straight ahead to where the chart is. Okay,
Yeah.
you can maybe look towards the upper corner. I'm going to just shine light from the lateral side. A little bit closer. Okay, this is just the shadow test. It's just checking the openness of a particular part of the eye. Yeah, the left angle looks a little bit wider. But we are open on the right hand side. There's not much between it actually. Lovely. Okay then. So I'm going to pop the first lot of eye drops in there.
Okay.
These aren't the ones that blur the vision. These are just a little bit of anaesthetic.
Alright.
Okay, so it just tingles a little bit for a few moments.
Okay.
And then it wears off. Just leaves your eye numb for about 20 minutes or so.
Right.
So obviously try not to rub your eyes.
Okay.
If you rub them too hard, you damage the eye, you won't feel anything. That's the last thing we want. Okay, so when you're ready, if you look up to the ceiling for me. Put one drop in the left. Okay, let's take a few blinks. Okay, keep looking up. Lower this side. Drop it in the right. Okay, I'll just give you a moment. How do you feel there? Is it easing off?
Yeah. Stung a bit when you put it in, but
Yeah.
it stopped stinging now.
That's normal. Okay, good. So I'm going to check your eye pressure now. So basically, this test, the front of the probe just gently touches the front of the eye. But obviously
Right.
that's the part of the eye we've anaesthetised, so you won't feel
Okay.
the probe touching your eye. It's only going to make contact for a few seconds.
Alright.
I'm going to be resting against the forehead as I do it. Just a few things to note. Always keep both eyes open.
Yeah.
Okay, breathe normally. And I want you to keep looking at one point into the distance. And maybe just the corner of the chart again.
Okay.
Is that alright? Okay.
Yeah.
I'll be as quick as I can. Let's get this set up there. Okay, so open your eye a bit wider for me, please. Keep looking towards the corner. Just got to look through the machine. Just the dial. Okay. It's nice and quick, isn't it, that one?
Yeah.
And you didn't feel anything at all, did you?
No.
Lovely. Okay, so that's about 14 mil of mercury. Keep looking straight ahead. Eye a bit wider. Looking at the corner of the chart if you can. Keep your eye there. Just a little bit. Breathe normally. That's 16. So there is a difference of 2 mil of mercury. Might not mean much at all, but could be significant later on.
Right.
Okay, now we're coming to the drops to dilate your pupils.
Okay.
Alright, so I've done a few pre-checks. We should be fine to use this. So when I pop one drop in each eye, I'm going to ask you to wait in the waiting area. Okay. About 20 minutes and I'll call you back through.
Alright.
Alright, so let's pop the light on. Right, I just need you to look up to the ceiling again. Okay, this shouldn't sting like it normally does because you've had the anaesthetic in first. So one drop in the right. Okay, keep looking up. There we go, one drop in the left. Just close your eyes for me. Just going to pinch the bridge of the nose. Okay, so the reason for this is just so your eyes, give your eyes a chance to absorb as much as the drops as possible, the tropicamide, just by occluding the drainage system there. So we're essentially just shutting off the canaliculi. Close your eyes still, just a little bit longer. Okay, I'm going to ask you to wait in the waiting area now, alright?
Okay, that's a funny gadget you've got there.
I'm going to be using this device to look at the back of the eyes. It's essentially, it's an ophthalmoscope, a viewing system.
Right.
So essentially it's head mounted. Let me just set it up. Light source there. Just have a look at we want the white light. I'm going to use the largest aperture there. Just bring the brightness down a little bit. Don't want it to be too bright because of your light sensitivity. Okay, just give me a moment. Just check the viewing system. The right pupillary distance. Super. Okay. So you don't have to do much. All you have to do is look into the distance or any particular direction.
Look at that test chart again.
Yeah,
Right.
that's fine. Okay. So what I'm going to do is I'm just going to be in front. I'm going to be holding this lens here, this 20 diopter lens. Okay. And just looking at the back of the eye.
Do I need to keep both eyes open?
Yes, please. Yeah. Okay. Right. Back a little bit. It's going to rest against the forehead. Keep looking straight ahead. Okay, just looking up to the ceiling next. Okay, up and right. Good view through the dilated pupil there. Okay, just directly to the right, about where my hand is there, a little bit higher. Now down and right. Just going to lift the top lid as well. Okay, straight down to the floor. Okay, down and left. Excellent. Okay, just looking over to your left hand side, a little bit higher up for me. Okay, yeah, so it looks as though we have a retinal detachment on the nasal side there. Not to worry, just looking up and left for me. Okay, just looking straight ahead at the test chart corner. Let's have a look at the macular area. So it looks like a macular off, retinal detachment from the nasal side there, and that's obviously why the vision is very poor, because it involves the macula. Right. Okay. I think what I'm going to do is I'm going to make a referral to go to the eye hospital today to have this seen to. They obviously need to reattach the retina if possible. Before anything else, let's just check the left eye, because obviously we want to catch anything going on potentially here. Okay, just looking to the opposite corner on the test chart there.
Yep.
All right. Check this is correct. Open your eye a little bit wider. Looking up to the ceiling now. Okay, up and to the right. Okay, directly to the right hand side. Just looking down and right. I'm going to lift the lid again. Straight down to the floor. Okay, down and left. Lift the lid one more time. Okay, directly to the left hand side, about here. Now up and left. So I'm pleased to say there's no signs of tear or detachment in the left eye. So it's all in the right eye, isn't it?
Yeah.
Basically the retina sends the messages to the brain. It's detached, it's come away.
Right.
Which is why your vision is very poor. It could have happened due to your coughing fit last night.
Right.
So what I'm going to do is I'll ask you to wait in the waiting area again. I'm going to write you a referral to take straight to A&E.
Yeah.
The eye department is just next door to A&E.
All right.
And you need the ophthalmologist to have a look at it today to see if they can treat it.